Welcome everyone, and thanks for joining us today for this webinar on self-advocacy and applying for the NDIS. My name is Liz Wilkinson and I'm a project manager for the Mental Health Coordinating Council, or MHCC. Before we go on, I'd like to first acknowledge the custodians of the lands on which we're all meeting today, and from where I am, that's the Gadigal people of the Eora Nation. And I'd like to pay my respects to their elders past, present and future, and recognise their continuing connection to land, water and culture. Next, a quick note on housekeeping that for today's webinar, you really can just sit back, watch and listen, but you can also ask questions, which we'll try and answer later in the webinar or after the webinar today. To ask a question, simply scroll down to the bottom of your screen and you'll find a Q&A button there. You click on that and a Q&A box will open up and you can just submit your questions through there. Today's webinar is brought to you by the Mental Health Coordinating Council, which is the peak body for community managed mental health organisations in New South Wales. It's also done in partnership with MDAR, which is the Multicultural Disability Advocacy Association. And one of the other things, and also, sorry, we have guest speaker from Family Advocacy as well. And one of the things I wanted to draw your attention to today is the reason that we're here is it's part of the Reimagine Today project. That's the Reimagine Today website, which is a support resource for people with mental health conditions for accessing the NDIS through the psychosocial disability stream. And that website, since its success, it's been very well received since 2017. And so the NDIA funded us to do some further work with it, building more resources for different priority populations, as well as building some skill building resources for people to support them along their journey of accessing the NDIS. So we're talking about skills like self-care, decision-making and self-advocacy. And these were all identified as important skills by and for people with mental health conditions as sort of important for the NDIS journey. And self-advocacy continues to come up in discussions as a topic that people want more support with. So that's why we're here today. As we continue, I'd like also to acknowledge people with lived experience of mental health conditions or distress and their families and carers, including those online today. The role that we each play in the reform of the community and mental health services sector is invaluable, and I thank you for your contributions and encourage you to continue fighting. So what are we talking about today? There's a lot to cover, so it's a bit of a long webinar today. So thanks for staying with us. But we're going to cover a bit about what is self-advocacy and some of the practical advice around self-advocacy broadly, why it's important for the NDIS journey, including some of the challenges you might experience when applying for the NDIS and ways to address these, personal experiences of the NDIS and advice to others going through the process, advice to carers or other supporters for supporting someone with the NDIS and advocacy. And we'll also be looking at some of the resources available and answering some of the questions that you've submitted. So without further ado, I'd next like to welcome Nina Levite, who is a capacity building and support officer with MDAR, which is the Multicultural Disability Advocacy Association of New South Wales. And Nina has a wealth of practical experience in advocacy and particularly with supporting people in self-advocacy around the NDIS. So Nina will be doing most of the talking today. I think she's just about to join us. Welcome, Nina, and thanks very much for being with us today.
Hi, everyone, and thanks, Liz. That's great. Yep, I'm a bit excited about today. So I've got a few slides here, everyone, and apologies if it's a lot. All this will be available to you by request if you want it after the session. So I'll just go ahead with introducing myself. I'm an individual advocate for Multicultural Disability Advocates Association New South Wales. I'm located in Bega, which is in southern New South Wales, pretty close to the Victorian border. And I support people with any type of disability, and that includes psychosocial disability. Next. So what is advocacy? An advocate means to promote, protect and secure a person's rights. So at times when somebody feels that they don't have a voice, or they don't have the words to ensure that their voice is heard and their rights aren't breached, and also to have information about what are their rights, not only as a person with disability, but a person living in our society. We all have rights, and sometimes people don't really have the information. So that's one of the things that we do, and advocate for people to give them the information and for empowerment, so they can make choices and then request support when necessary. Next. Next. Oh, okay. Looks like I've gone. What's happened? Sorry, guys. I've been disconnected from the video.
I'm not sure.
I can see it on my phone. Can you guys hear me? Am I in?
Can hear you definitely.
It's reconnecting to the.
Can't see yet.
No, but I could use this video, but that's gonna. Will I just go ahead with speaking? Because I've got the slides coming up on my phone, so that was a good backup. Sorry about that, everyone. How to self-advocate. So these are some points that you can use for reference. Be clear about what you want. Speak to someone you trust about your wants and goals. Find out about your rights. Make a plan about how to achieve your goals. Become informed, research, ask questions, find out what services you need help to achieve your goals. Speak up when you feel you are being treated unfairly, and this is really important, where a lot of people, the audience becomes they pick the wrong audience, so it's about finding the right audience to speak up. Keep a record of your communication and agreements with service providers. Join with others to help you build the skills you need to self-advocate. Example, a community group, attend school courses, connect with advocacy associations. Next. Advocating for someone else. So this is a little bit different to advocating for yourself, and these are the points that you should take on board when doing so. Keep the person at the centre of the process. Listen carefully to find out what the person wants. Work with the person to determine their rights under the circumstances. Make a plan with the person to achieve their goals. Because remember, it's their goals. That's sometimes when we're advocating for someone else, we can sort of go in thinking that, you know, our opinion matters, whereas it's only matters when we're asked. So consult with them regularly, working in partnership to achieve their goals. Mobilise people and services to work towards the achievement of the person's goals. Work with others to avoid personal struggles, likes or dislikes from interfering with your efforts to achieve their goals. Prioritise their values, putting aside your own, and keep a written record. Next. Okay, so this comes from the United Nations Convention of Rights of People with Disability. In 2007, the United Nations passed a legally binding standard that says people with disabilities have the same rights as everyone else. As a signatory to the convention, the Australian government must take action to end disability discrimination This includes making new laws to protect people's rights, to enforce these laws, and to educate the public. Next. Every person has the right to be treated equally, be safe from violence and abuse, have a home that is adequate for our needs, be part of a family or to start our own. Privacy, to have our private space and our information to be kept confidential. Live independently in the community, work in a job we choose to earn a decent living. An education equal to everyone in the community. The best possible healthcare, access public spaces and public services, vote and have a say in laws and policies that affect us. Participate in arts, sports and leisure. Next. Disability service standards. Now, a lot of people with a disability or live with a disability don't realise that there are 6 standards that are under legislation that every service provider that provides a service for people with disability has to comply with. And they applies to all disability services. Services are required to follow the standards of rules in order to ensure compliance with the law and their funding agreement. People who use the disability service have the right to be treated fairly when using the disability services, participate in the community and feel included when using disability services, have a service that supports them in making their own choices and works with them towards their goals. Give feedback and complaints about the service. And this is really important. This is where a lot of service, they're not transparent enough when you join a service or sign a service agreement. Always ask for their feedback and complaints policies. And how do you make that a feedback or give, a complaint? Because a lot of people, when it comes to that point, they don't really know who to go to, how to do that. And it's your right to always be able to give feedback and make a complaint at any time. So make sure you ask that one when you join any service provider or sign a service agreement. Access the services they need. Have a service that is managed well. Next. Exercising our rights. If there are changes you want to make in your life and you need to access services to do this, you can speak up and ask to access these services. If you're unhappy about a service and feel that your rights have not been respected, you can tell these service and let them know what kind of changes you want to happen. Services are not allowed to make you feel bad or to stop giving you support just because you made a complaint. Next. Oh, you got it. Barriers to service access. So sometimes there are barriers, and these are the ones we've identified. Lack of accessible information. Information is not available in community languages. Now, all service providers can access that information through a translator. So even if they don't have it in written form, you can always ask for a translator and they can book you one. Not provided in a format suitable for different types of disability. And that's really important because sometimes some people can't access emails or online information. So it has to be, they have to have avenues to be able to give you that information in a way that you can receive it and be able to understand it. So make sure you have that conversation with them if they're handing you information that you're not sure about. Not provided in a plain language, and that references back to what I was just saying. Information is difficult to obtain and again then only available on the internet. I sort of think that's a little bit discriminating when services go, jump on our website and you can access all the information there, or send me an email. Some people don't, they choose not, it's not because they can't use the internet, it's sometimes people just choose they don't want to use the internet, and that's their right to do so. Social isolation is another factor to barriers to service access. Limited support in finding out what services and options are available. lowered self-confidence in questioning or challenging services, feedback regarding system gaps or improvements are not communicated to service providers and policymakers. So when it comes to social isolation, that's a barrier in itself for all areas of someone's life. So if you can, reach out to those service providers and ask for support. The other barriers identified is access to technology, as we spoke about before, and interpreters. But, you know, like interpreters can be booked at no cost to you, so that should not be a barrier. Lack of skills, difficulty speaking up, writing letters to service providers, lack of skills or knowledge in the use of technology, lack of knowledge of the disability sector. And this is where engaging with a disability advocate or an advocate or someone that you can trust to be your advocate is really important. Next, responsibilities. So with rights come certain responsibilities. While speaking up for ourselves, it's important that we also respect the rights of other people, take care in making decisions, take responsibility for our actions and the decisions we make. Next. Individual advocates, this is how we can help. A person can sort out the problem themselves, support them to raise concerns with services, attend meetings with the person, negotiate with agencies, write letters, support them to complete applications, refer to agencies with expertise skills. Now, in saying this, the advocate still has to, it's not about them writing the letter the way they think it should be written or negotiate with the agencies using their own words. It all has to be with the person they're advocating for. It needs to be their words are said. Even if they don't want to speak, an advocate speaks on their behalf, but only with their consent, never to do it without their consent, and have a conversation about what the goal is and what the aims are of the meeting or the letter, or, you know, raising those concerns with services. It always has to come from the person you're advocating for. Next. So it's just a list of our offices. If anyone wants to contact us, head office is in Granville. Regional advocates are in Griffith, Newcastle, Wollongong, Hurstville City and Inner West and Bega. And who is eligible? So a person with identifies with a disability, their family or carer. We don't need a diagnosis. It's, you know, people come to us and think that they've got to give us some paperwork. It could be anything from, even if a person suffered from anxiety without a diagnosis, that's good enough for us. We'll just tick that box. A person lives in New South Wales and it's no age restriction, so it's 0 to whatever. And now this bit where it says a culturally and linguistically diverse or non-English speaking background, I'm sure since making these slides that's changed, because especially in Bega, we don't have the demographics of a you know, non-English speaking background. Most of the people we engage with come from an English speaking background, so that doesn't apply wholly to accessing our service. And it says that down the bottom, that Bega office. And that's our contact details. Now, all this will be available if by request. So I'll pass that over to Liz to, well, we can ask her at the end on how that happens. So thanks for listening. I hope it wasn't all too much for you. Sorry about the visuals. I'm trying to connect back in. So I would like to welcome Annalise Constable. She is a participant on the NDIS and has a lived experience in self-advocacy. So welcome, Annalise.
Hi everybody. Hi, my name's Annalise and I experience mental health distress. I'd like to, before I begin, I'd like to acknowledge the traditional custodians of the land on which I am currently sitting, which is the Gadigal people of the Eora Nation. I would like to share with you my journey of applying for the NDIS and my experience of self-advocacy. So I decided to apply for the NDIS with the help and encouragement of a local mental health organisation. And specifically, it was one individual staff member, Zara, who really committed to helping me. And I'm forever grateful to her because the help that she gave me has completely changed my life. Zara and I worked together on my application for the NDIS for about a year. And as Zara was more familiar with the NDIS, she project managed the process because at times I would get overwhelmed by the enormity of it all because it is a very involved and complicated and ever-changing process. Zara and I would decide on 1 or 2 tasks a week and break these tasks into manageable chunks. For instance, like for me going to my GP and asking for a report about my health history, or emailing or calling a psychiatric hospital I'd been admitted to and asking them for my hospital records. And as the application process is very focused on what I can't do and what I struggle with, support from the biggest support that I got was from my psychologist, my partner, Emily, and my friends. I really needed support throughout the whole application process because it really is focusing on the things that I struggle with. It doesn't necessarily celebrate, you know, my talents or the things that I am capable of. If you decide to apply, I just want to encourage you to stick with it. I found the process very difficult and I really wanted to quit numerous times, but the people around me encouraged and supported me to continue going. And I'm really, really grateful that I continued to apply because my application was successful. It's afforded me a lot of independence and yeah, really, really helped me be more engaged and independent and connected. So how did I self-advocate when I was applying for the NDIS? At first, I worked hard to figure out what my goals and my priorities were, because knowing my goals and priorities helped me communicate clearly what I needed and what I wanted. I went into the NDIS application process knowing that out of everyone, all the specialists, all the doctors, support workers, anyone, out of everyone, I know myself best. I know what I struggle with, I know what I excel at, and I know what I need help with. And I'm the only one that knows my experience, and this gave me the confidence to advocate for myself. And while I don't have a tertiary qualification related to mental health or disability, I do have over 30 years of lived experience of being me. And I also tried to remind myself that, you know, like I know that disability welfare and care systems are often developed to make it hard to apply, to deter people from applying or exhausting them through the application process. And reminding myself that helped me get back up when I fell and when I tired of the process, because it really felt like a battle of epic proportions, being someone who felt quite vulnerable and with a lot of needs and minimal power, asking a powerful institution for help and support. My experience of self-advocacy, when I was advocating for myself in the NDIS process, it was tiring and it was rewarding. It was tiring because it's a long and involved process, and I was met with some resistance, which I'll talk about a little bit later. And the process was also rewarding in that it increased my self-esteem and confidence in my own voice and ability to stand up for myself. It gave me a voice and a sense of influence in a society where people with a disability, including myself, often feel unheard. I've got some examples of self-advocacy that I wanted to share with you. So the person, Zara, who really helped me with my application, told me that my best chance of being accepted for the NDIS was to reflect the exact language of the NDIS that they use in their paperwork. And so when it came to a psychosocial disability, which is what I have, Zara and I created a document that outlined the specific language that needed to be reflected in my application. So when I asked my psychologist to write a report for me, I gave her a guide of the language that Zara and I had identified. And I asked my psychologist, Lucy, to use this guide when she wrote the support documents. And she did, and she used that specific language. And I was really grateful for this, as it showed she understood how important it was to reflect that language, but also that she had listened to me. Then I went to my GP and with the same guide and asked her to also use this guide and language when she wrote supporting documents for my application. And she didn't follow the language the first time, so I asked her to do it again. And she didn't follow the language the second time, so I went to a new doctor. That process was tiring for me, but I knew it was important. It was tiring and time consuming because I had to make multiple appointments and have multiple conversations with the doctor who didn't follow that guide. But in the end, it meant that I found a new GP who listened to me, who reflected that language I asked her to reflect. And I would say, if someone in your care team isn't listening to you, I would recommend you move to a new care provider, hopefully find someone who does listen to you. I also, in my application process, went to a psychiatrist who told me that there was no way I would be successful in my application for the NDIS. And he made this claim without a thorough knowledge of my history or a familiarity with me and my mental health struggles. It was the first appointment I'd ever seen him. And through tears, I persisted that he write a letter outlining my diagnoses, regardless of his opinion of whether or not my application would be successful. And he wrote the letter. It was a very distressing appointment to attend and a distressing way to be treated. And in some ways, it's funny to admit, but him saying I would never be approved really motivated me to prove him wrong. And when I was successful in my application, I wrote to him to let him know that how he treated me and what he said was unprofessional, inconsiderate, and best of all, that he was wrong and that I had been approved for the NDIS. And I just wanted to offer some advice, which is just don't let anyone else tell you what you are and are not capable of, or whether or not you are eligible for the NDIS. If you, if you feel like your life is disabled by a disability, then and you fit the other criteria, then please apply. What tips or advice I have for others? I would say the big one for me in the whole process is self-care. And I know the Reimagine website has a lot of information about this, so I'll go over it a little bit briefly, but if you want more, check out the Reimagine website. I found that looking after myself was the most important thing throughout the NDIS application process, and even now that I've been accepted, because I know that I needed to be as strong and healthy as I could be to go into battle for myself. So that was about sleeping, getting the right amount of sleep, eating healthily, exercising, and finding healthy ways to express how I was feeling throughout the application process, because I really did feel a lot throughout the process. And I continue to feel a lot when I have to talk about the NDIS or go in for a review or interact with the support organisation. The application process was draining and depleting for me. And I would always make sure that I followed up NDIS related activities with something that is nurturing or gives life to me. For me, it's walking my dog or going to the beach or having a nap and talking to someone that I trust. And I know that there's some questions in the Q&A for me. I'll go and check that out once I've finished speaking. So I'll be with you in a moment there. Another tip or advice would be finding someone or an organisation to help you. support you through the process and explain the process and the language that's used, because the NDIS is also constantly changing. And the language, yeah, so it's hard to stay on top of it for any individual. So having a bit of a team is really, really helpful. I want to echo what Nina said earlier, which was prepare and plan as much as you can. And for me, it was really important to find a great GP who is literate in my disability. So for me, my disability is mental health distress. So I made sure I found a GP who has a familiarity with that topic and knows how to write and talk and interact around that disability. And she's been able to support and guide me. I've also never met with the NDIS on my own. I always take a support person. I always leave time to debrief after those meetings, because I always have feelings that come up during that process. And then I have someone there to discuss those feelings with. So when I do have any kind of communication with the NDIS, I take thorough notes. I get the name of the person, the time of the call, all the information that I've gotten from them, and keep documentation of that, because I'll get a lot of conflicting information from differing organizations and differing people. And then that way I have my own record of what's going on. In terms of resources and supports, my most important resource were the people around me in my personal life, and the people who could support me to navigate a frustrating and sometimes demeaning and stressful process. So that's like my partner, Emily, or, you know, the local mental health organization that I work with at the time, Zara, and now, you know, I've got a different support worker there, my psychologist, my GP, my dog Peanut, who you can see in the photo on the screen there. He's a huge support. Like he's with me all the time. He motivates me to get out and about, to be healthy and be outside, and sometimes just look at the sky when I'm feeling stressed and realize the world is bigger than the NDIS. On some Facebook groups. So there's like Facebook groups called Mental Health and the NDIS, or I'm in another group called Sydney Queer and Disability Group, or Squad for short. And myself, like I was a big resource to me. The resilience that I have, the life experience that I have, the life experience that anyone with a disability has, like, again, you know yourself best. So try to back yourself and speak up for yourself if and when you can. And if you can't, asking someone to come along with you who can support you to do that, or they can speak on your behalf in ways that you've asked them to. Since having an NDIS plan, it's really helped me with inclusion, in that it allows me to participate in social and community activities more. I have funding for a support person to come along and support me when I want to do something that might be challenging for me. So, for instance, I often have trouble going into shopping centres or going to health appointments, and having someone else there with me means that I can go and do those challenging things. It also means I've been able to engage a support person who's helping me participate in more creative endeavours. So at the moment, well, I'm a performer and a writer, and I do stand-up comedy, and I have started doing gigs around Sydney, and I was going to Melbourne Comedy Festival last year, but because of COVID, I couldn't get to go. And this year, I'm waiting until next year until it's a little bit more certain. And yeah, one of my support workers is really helping me achieve those dreams and those goals. And since having the NDIS, I have like a level of independence and a level of support that makes things that seemed impossible for me previously, they really do feel possible. Thanks for listening. I'll go into the Q&A and see if there's any questions there for me now, but thank you very much.
Thanks so much, Annalise. I'm so glad to have got you to come and speak with us, and yeah, definitely getting some comments through on the Q&A about how inspiring and powerful your story is. So thanks very much. I think Nina is hopefully coming back to join us. Yes. Oh, and we have video as well. And do you have audio?
Yes, I do.
Good. Yeah, and thanks again, everybody, for the nice comments there for Annalise, who I think will be able to answer those now as we continue.
Okay, thanks, Liz, and thanks, Annalise. I got a bit weirded out when I couldn't have the visuals going as well, so I was going to maybe talk a little bit more about self-advocacy, yet Elise covered it so well. And thanks for that, because I think we have privilege to have her as part of this webinar. And all those points that she made, I see that situation over and over again, especially the bit where she's talking about, where she's gone to do the NDIS application and the GPs, the health professionals just were not listening and understanding. So, I think that it's really important to have that self-determination of continuing to ensure that you all receive, services, and health services are really important. Find somebody that takes the time to develop a rapport with you and reflect, to provide this service to reflect your goals and your life choices, because they are yours. You are in the driver's seat at all times, and I commend Elise for doing what she did. Like she said, it was a hard slog, it was exhausting, but at the end of the day she had a goal, and that was to make sure that she was heard, and what they were writing was true and correct to reflect her individual circumstances. And individual is a key word here, because advocacy looks different for every single person, and also it's not like a broad thing for the person for the rest of their life, because we all change, and some things that are important to us today may not be as important to us tomorrow. So it's transient as well. And I didn't get an opportunity before, but I will now. I would like to acknowledge the Yuin people, traditional custodians of the land but I'm residing on at the moment in Bega Valley, which I pay my respects to the elders past and present. So jumping into the next lot of slides, and this one's about the NDIS. And as Annalise pointed out, it's a world of its own, and the other thing is it's really important to look after yourself during this time when you are applying for the NDIS. But yes, to ask for assistance from a support person. I think the NDIS website is hard to navigate for some people, and when you ring up the NDIS, you often get a lot of different representatives. You don't know how long they've been there for. They're pretty much just reading what they see on the website, and they might have a few extra notes, but I don't know, because I just find they always end up with giving you different information or less of information that you already know is available. Okay, so the NDIS will provide all Australians under the age of 65 with a permanent and significant disability with the reasonable and necessary supports they need to enjoy an ordinary life. The NDIS will help people with disability achieve their goals, including independence, community involvement, education, employment, and health and wellbeing. As an insurance scheme, the NDIS takes a lifetime approach, investing in people with disability to early to improve their outcomes later in life. Next. So what's the criteria to gain access to the NDIS? Well, firstly, have a permanent disability that significantly affects their ability to take part in everyday activities. Now, that's the tricky one, because that's what they really want to know. They want to know, how does your life differ from somebody else with your functional capacity? And that looks different for everybody. But if you cannot prove this part, that's where the challenge comes. So that's where good documentation, having good health providers that can give you that documentation. If you have friends or family or carers, there are other people that you can use as resources. A lived experience statement is really beneficial at this stage as well when you're applying, because you really do know what your day looks like. And to break it down in easy steps for the NDIS to understand what your day looks like and the challenges that you face daily is a really significant part in applying for the NDIS. Must be age less than 65 when you first enter. Now, with that, you can apply when you're 64 and 5 months, and it might get knocked back, or it might take you a while to get all the documentation in. But from the date of applying, if you then go through an appeal, then an internal review, it still is from that date. But if you reapply and you've gone past 65, then you're not eligible with a second application, to just keep that in mind. Being an Australian citizen or hold a permanent visa or protected special category visa. And you must live in Australia where the NDIS is available. And it was introduced from 2016. We're well and truly rolled out by now. There's the number. I think they go till about 8 o'clock at night now. So they're making themselves more available. That's the number, 1-800-800-110. Next. How do I help someone gain access to the NDIS? Well, as an advocate, we come on board with just providing the information first, so people can understand what it's all about, because it's really confusing for some people. Other people they're not really interested in the detail. They just really want to know what they need to do and what they need to provide. So it's up to the individual of how much information they want in writing, or I've got booklets that people just go, I don't want all that information, just tell me what I've got to do, and do you think I've got I'm eligible. So one is disability permanence. So it has to be, so the disability, you have to have a disability. It could be physical, intellectual, psychosocial, medical, even medical, like if you have a medical condition that impacts on your functional capacity, it can be classified as a disability. So what some people think is a disability just may or not think is a disability. It's good to just check. Permanent. So it has to be proven that it's either lifelong, permanent, or likely to be permanent and lifelong. They keep rewording this in the NDIS access forms, but it's not. If it can be treatable and it can be treated, and within a couple of years you don't have it anymore, then you wouldn't be eligible. So that's why they ask for early intervention if you've had treatment for these for your disability. Substantial reduction in functional capacity. That's where I was talking about before. That's the key there, is they really want to know how your disability impacts your day-to-day functional capacity. Social and economic participation affected, and that's where in the access, they provide evidence there as well. And lifetime need for NDIS support, so it has to be for life. In saying this, the NDIS was actually designed so that you that you don't all the supports that you get, and from the funding and the goals that you've identified each year, that you in time you can build capacity in those areas and obtain those goals. So in the future you may not require as much support as you did originally, because you've got that. But in saying that, a lot of people will lifetime need for NDIS support. Their plan will probably, and their supports will look similar. And as people age with a disability, it's only natural that the supports that they'll need more. So if you look into the NDIS and how it was established and what the goal was for it, I don't actually know if that's going to really happen. I think that they may have to look at that, and the NDIS guidelines change, the way they're delivering it changes, and that will just keep evolving as time goes on. Next. So provide evidence that you have a disability, and this comes under the section 24.1, which a lot of people that if they've applied, they'll often see this and go, what does this mean? So a disability must be caused by one or more impairments that are intellectual, cognitive, neurological, sensory, physical, or psychiatric. So you can have a primary disability listed on your application, and you can have a second, and you can have a third. So in some cases it's complex because people will have a couple of things. They'll have psychosocial, physical, psychosocial, intellectual, or neurological. So you can list the primary one that you think impacts on your functional capacity the most as the primary. How do you gather the evidence? Now, this will be on each slide. So preferably from a specialist, a speech behavioural psychologist, otherwise from your GP, but it's from a health professional. That's what they're looking at. Specialists, they love specialists' letters, and reports, which are always hard to get, and an OT report is pretty good too. Next. Permanence. Provide evidence that the impairment or impairments are or likely to be permanent. Evidence of treatment. This is where they like to look at the treatments. What treatments have been tried and when were they tried? This is tired, sorry, wrong spelling. Were the treatments effective? Why or why not? Have all the treatment options been exhausted? Now, in saying this, you still be having treatment if you may require treatment and ongoing for life. That doesn't mean that you're not eligible. This is where it gets a bit confusing for people about the treatments, but they just want to see, if the impairment is degenerative, provide evidence that the medical or other treatments would not or would be unlikely to improve the condition. It doesn't mean you're never going to have treatments for your diagnosis. Next. Substantial reduction in functional capacity. If available, provide evidence that you cannot participate effectively in one or more of the above activities without assistive technology or equipment, or other than commonly used items such as glasses or home modifications, or without assistance from other people, including physical assistance, guidance, supervision, or prompting, or at all, even with assistance to assistive technology, equipment, home modifications, or assistance from another person. Next. Substantial reduction capacities. So they want to look at areas in these 6 activities: communication, social interaction, learning, mobility, self-care, and self-management. Now, you don't have to have all those where you need support. It might only be one. It might be just mobility. It might be self-care. It might be all of them, or 3 or 4 of them. It doesn't matter. You just pick those categories where you need the support. Next. So communication, for example, being understood in spoken, written, or sign language, understanding others, expressing needs, wants by gesture or speech. So normally with the communication, it might be through assisted technology. It may be from support from a person. Next. Social interaction, making and maintaining healthy relationships, interacting with the community, behaving within limits accepted by others, coping with feelings and emotions in social context. And a lot of this comes from either therapies, treatments, or support from another person. Next. Learning, understanding and remembering information, learning new things, practicing and using new skills. Again, with assisted technology and support from another person. Next. Mobility. Move around the home, transferring in and out of bed or a chair, leaving the home, moving about in the community, performing other tasks requiring the use of limbs. So this is and with the others where an OT comes in, because they can make an assessment about what you actually require, whether it's just purely assisted technology, support from another person, you know, even vehicles these days, the NDIS will fund them to be modified. So it's an OT assessment is quite pricey. You can actually request an OT assessment through a local hospital. It may take up to 6 months for the referral to be actioned, but it's worth doing because you may be living with a disability without the right assisted technology or supports. So I just thought about mentioning that here. Next. Self-care, activities related to personal care, hygiene and grooming, meal preparation, eating and feeding yourself, caring for your own health needs. This is where having a support person is really invaluable for these tasks in your everyday life. And that's where the NDIS can provide that support. Next. Self-management, completing daily tasks, making decisions, problem solving, managing finances. This is one where, you know, it's a bit like it's an invisible one. People may appear to be competent in all areas of this self-management, but when it comes down to just really tiny, like breaking things down into steps, you know, if you really think about it, you may be struggling in some of these areas, and support from another person is really invaluable. And so have a really good think about the self-management side of things, because even that one where it says making decisions, well, you know, most people will answer that question of, yeah, I can make decisions. But sometimes with making those decisions comes challenges. So that's where support from another person does help. And problem solving is one where, you know, having the right people supporting you really assists in that everyday problem solving. Next. So social and economic participation. So provide evidence on how the impairment or impairments affect your capacity for social participation. For example, going to social functions, going out with friends. Now, Annalise touched on this, and it's one that people do struggle with. You know, like I've got some clients that in their plan, they just require someone to go to the first few outings or group activities just to have somebody with them to support them, and then they're okay. And other people require somebody with them at every event, because it reduces a lot of the anxiety and those challenges that they face. So that's here where you would say, like, what would you do in those situations? How do you manage those situations? Some people just forego social participation, so that's impacting on their life choices because they don't get out to do that. So this is a really important one to think about. Economic participation, finding and keeping a job. So the NDIS does fund support for finding and keeping a job in that category. So if that's something that's one of your goals, it definitely is identified by the NDIS plan. Next. Lifetime need for NDIS support. So provide the evidence that you are likely to require NDIS support for your lifetime. Provide evidence that your support needs cannot be met through another service system. That means that there's no other services that can provide you with the support. And that's becoming more and more the trend now as we're heading into NDIS, that a lot of services, unless you've got an NDIS plan, they're not providing people with support. So people are missing out on the support they require. For example, have you explored any of the following options? If so, why are they not suitable? GP mental health treatment plan, GP management plan for chronic diseases, community care services through New South Wales Health. So sometimes the NDIS will come back after you've put an access request in and say, your disability can be supported through other services, and usually they're talking about health service. But we know that not all health services can provide the day-to-day support, like, helping somebody prepare a meal and taking them shopping. Next. Internal review. So if it comes back saying you might have met disability criteria, but you may not have met the functional capacity criteria. So this is where a lot of them that come back with a disability is recognised as permanent or likely to be permanent, but there isn't enough reduced functional capacity that's been substantiated by what the information that's been given. So you can put a review in, has to be done within 90 days of receiving a decision. This gives you time to get some more documentation or reports to support your access. So decisions can relate to funding, access, or plan management. Internal review decisions are sent through the internal reviews team. So it's supposed to be looked at through fresh eyes, through a different team who performs the reviews, and must not be the person who is involved in making the original decision. So it's at this stage, it's good to resubmit everything with the additional information, because the next person looking at it may see it differently. So it's always important to take that avenue. The reviewer should advise the person affected of the likely decision before sending out a written notice. This gives the person a last chance to provide any additional information. Next. External reviews. So if that process through the 90-day, the internal review comes back with a decline, you then can apply for the AAT. So then you have 28 days to apply. It's free. You have to give a reason why you think they made the wrong decision, and then it'll go through, there's a hearing process. It very rarely goes to a legal hearing. Usually it's either resolved by then, or the person just says, I don't want to do this anymore, because this process at this point can sometimes take up to a year to 2 years to go through this. So this is definitely somewhere where you really require support from another person. You can, at this stage, apply for legal aid support and have a legal aid solicitor represent you through this process, which is advisable. Within MDA, we have an NDIS 2 appeals officers. So they're the people that we refer you to at this stage, plus an advocate can support you as the person that comes to the hearings with you. So the AAT will work together with the participant and the NDIA to try to reach an outcome. If an outcome cannot be reached, then the AAT will make their final decision. This decision cannot be contested unless it relates to an area of legislation and can be taken to the federal court. And that's the end of the presentation. I have here practical advice and scenarios applying to the NDIS. I think I sort of covered a couple there, and I'm just being mindful of the time. So if you've got any questions in regards to the two presentations, just post in the Q&A, and we'll answer your questions at the end of the session. So I will now introduce Karen from the Family Advocacy. Welcome, Karen.
Thanks, Nina. Thanks, Nina and Liz, as well, for inviting us to join the webinar, and so important to hear from Annalise. That was excellent. I'm joining you all from the traditional lands of the Darug and Ku-ring-gai people. So that's where I am today. My name is Karen Tippett, and I manage the advocacy and leadership development work of family advocacy. So I'm coming from a family's perspective today. So I'll just briefly let you know who we are for those who have not heard of family advocacy. We are actually a New South Wales-wide independent advocacy organisation. So our work is around families and supporting them to empower them with skills and advocacy knowledge and sector knowledge so that they can be effective advocates on behalf and with the person with disability in their family. So we're actually founded by families, been around for about 30 years. We're governed by families of someone with a disability as well. So very much still at the grassroots in our work. And our ethos, our values is really that we're really dedicated to seeing the family member experience a typical Australian life, an ordinary Australian life, and that's what drives the work of our organisation. We actually work systemically as well, and Annalise mentioned, I think, the need for greater change. So we work really hard systemically. We hear from a lot of families. We work with that information, knowing what it's like on the ground for people with disabilities and how they are having barriers, and we work systemically to change that and ensure policy and process is effective and useful. So we provide advocacy advice, and you'll see on that last point, we also now work directly around engaging people to work with the Royal Commission and to share experiences and their stories to the Royal Commission. Pretty much a Royal Commission is the most powerful and effective method in our country to have our voices heard as a group, and there's a lot of other organisations doing good work in this space as well, and I encourage you to share your experiences and to suggest to others as well, so that the Royal Commission can make effective change when they finish in 2023. Next. So as I said, my perspective is the family. So what is the role of the family? Why is that our model of advocacy here? Families actually do have a really understood and a legitimate role in our society. And they hold actually a lot of knowledge, historical and experience and knowledge of the person that they're representing, the person with disability. So that's one important thing. The power balance for a family working with a service to get good results and good outcomes is often very disempowering towards that family. So it's really important to empower a family to realise their advocacy and their effectiveness, and understand that they do actually have a natural authority. Of course, typically as well, families are the most constant relationship, can be the most constant relationship in a person's life, and they're for the long term. We're whole of life in the work we do, and I'm talking to parents, you know, with a baby right through to an adult, and looking at the future planning needs. So it really in it for the long term, and typically are less likely to have competing interests because they're coming, as that last point says, from a place of love, and they can therefore be passionate and persistent on behalf of their family member to achieve good outcomes for their life. So that's really important. However, obviously families actually have to have some good considerations as well, so that there's what they're effectively doing is ensuring that they are working hard for the person with a disability in their life. So regardless of what I've just said, of course, families are human, parents are human, carers are human, they have their own needs. And the reason they've got to be really aware of any competing or conflicts of interest because of that, between their own needs and the person's needs. They need to balance that, as a few people have said today. Of course, this should be balanced. They should be gathering their own support and looking after themselves. But it is important that when they're advocating, they are unashamedly biased and have the person's needs centre and paramount. So they've really got to be aware of that. The other point for families to consider, of course, in their advocacy is the capacity, building the capacity, of that person. So working on building their ability to speak up, their ability to have their voices heard, and that their independence is increased. So how can we build that capacity within the person? So as a young child, of course, the parent is a lot of a stronger voice, but as they get older, they've got to be able to really build that voice of the person directly as much as possible. There are people with very cognitive disabilities. It means they'll always be needing someone to be there and supporting and championing their cause, but it doesn't mean that they're not heard. They find there are other ways to be heard. Particularly just on this point too, with the introduction of the NDIS, I think all advocates are taking an increasing amount of inquiries about guardianship and the apparent need for this, particularly when someone has turned 18. I stress again the natural authority of families, even when the person is an adult. So building good relationships with banks, services, employers, any organisation that's supporting and working with that person is the best way to mitigate that. guardianship only is really necessary when there's a real breakdown in communication between family members around that person's needs, or there's some vulnerability, obviously, and negative things going on for that person, and that the guardian may step in. They don't want to step in, and they will only step in on a short-term basis. So it's not the answer to do guardianship. I will talk about something else in the next slide in a minute. But I also wanted to just, that last point, that families, it's important to champion the social model and not the medical model of disability. And I'm sure the audience today will understand exactly what I'm talking about, that the model for social model is about the need for change and adjustments around the person to meet their needs, removing barriers. It's not about fixing the person's disability or making them fit into the model that is and the environment that is around them. So thinking about the strengths and the skills of the individual and how that can lead to the ordinary Australian life that we are aiming for. Okay, thank you. Next. So now I wanted to just touch on tips from a family perspective to access the scheme. One, and I know Annalise talked about a couple of these as well from her personal experience. So anecdotal data is often overlooked in these assessments and accessing to the scheme, but please don't underestimate the power of actually giving the delegate that's looking at all the information a really holistic view, painting a picture of the person's life that they are now trying to find what are the right supports for this individual. So the anecdotal data is really keen. It balances and adds to the official assessments and reports that would be happening. It also aims to diminish a potential bias that is natural when we talk about families. We all have our expectations when someone says that they have a certain disability or they're a certain age. We have expectations of what that means. The anecdotal data can help to say, this is the person, this is unique to this person, and disregard those other assumptions that we all hold. The carer's impact statement, Annalise talked about the personal one, and there's also impact statements that can be done from a family's point of view. Because the other potential bias is that you're looking at a person of a certain age with family around them, living at home. There's all these assumptions of what the family is able to provide in terms of support. Two things that this will do is, one, work out maybe this family's actually got a lot of other competing issues going on that is really affecting their ability to support the person, so that can come out. The other thing is that the needs of that person is very individual, so it can come into, it can show them how this person functions and how their week looks and where the gaps are. So it can show a real need where the person might not would have assumed there isn't a need. So the carer's impact statement is important, and there are examples out there, and we can certainly share you some links. The other thing in how to get this statement across, how about using something else? Videos, there are templates out there for written, but other audio statements, thinking of other creative ways if that's going to help to paint the right picture and express this person's uniqueness. Okay, the AAT. So I often, when I'm talking with families, I share some of the decision summaries or the specific cases from the AAT. And that can help to, not everything that goes through, a lot of things get settled before it comes to a decision from the AAT, but the ones that do go out, go through the whole process do get published, and it can help to guide someone understanding what they need to put in stress so that it will get credence and get traction with the NDIS. So that can be a guiding kind of principle. Not everyone's going to be wanting to read those, I understand that, and we can sometimes pull out information for people and share that, but it is a good way of getting some more intel of the thinking of the NDIA. Nina's mentioned the life domains, and that is a really key thing to be referring to at all times. So even setting out a application and a statement that says, you know, here's the life domain, here's how that looks for this person, this is the functional concerns and barriers for this person. And again, there's a good link to direct from the NDIS site that we can share with you on that one. I mentioned the meaningful week, and that can come into this as well, where there might be gaps of need within that week that do require formal support. And we always stress to families not to disregard the informal support. We don't want all our informal support from family and friends, etc., to be replaced by paid and formal support. So balancing that to the best of that person so that they are getting that holistic needs in their life and not losing informal relationships because there's an opportunity to get a paid one in there. The primary focus is on the person's need and not the family's need. So I mentioned families do need to look after themselves, but the primary focus, because I do see a few applications where people are talking about the stresses of the family, and that becomes more dominant narrative than the actual needs of the individual. So NDIA is going to be completely looking only at what that individual's needs are. So really ensuring that any access information is around their needs, underpinned by this is a need because of a family impact, but not the family impact as the primary reason. And I mentioned the guardianship question. So one way to consider this is also within the NDIA is looking at maybe being a correspondence nominee, because if the person is receiving the mail directly, then often the parent or the correspondence, if you're a correspondence nominee, you will also get that information. If you're not, then it goes directly to the participant. If they've not got the ability or able to share that in a timely manner, often a review time period will lapse and things like that. So being a correspondence nominee can be a way around that. There are other forms of being a nominee within the NDIS, and you could have a look at those as well, such as plan nominee. But the correspondence one, I think, is quite a simple one. The participant does need to agree, but that can be done early on, and then that person is able to make sure that there's nothing going amiss and astray. And finally, seeking support. So seeking support it is really important for ourselves and for the person that we're supporting. So I've made a few tips on the next page of places to go to. So next. So other supports that you could go to. So obviously advocacy. You've heard from Nina with MDAR, and you've heard from me at Family Advocacy. There is a disability advocacy finder there, and I've put that in the slide. There's also finding an advocate through the Disability Advocacy Network Australia. Carers New South Wales provides service and support to support families who might be struggling or need that self-support. Carers Australia as well, and Carers Australia actually have quite a fair bit of information around NDIS and the carer impact statement, so that could be a helpful spot to go. Parent support groups, too many to mention. They're far and wide with our social media opportunities, but a great way to share information between people in the same sort of situations. Building your own capacity, building your own knowledge as a parent and carer. There are a lot of capacity building organisations coming through. In fact, Family Advocacy has an arm called Resourcing Inclusive Communities, which is a capacity building function and works around the self-direction, particularly in this topic of NDIS. As well as them, and I can add these later, but I haven't got them on this slide, but thinking of troubleshooting issues that are coming up, we often direct people to their MP. Go to your MP. This is, you're a constituent, this is a national scheme. If it's not working, go to your federal MP and have a discussion about what's not going on for you. Going to the Commonwealth Ombudsman if there's issues with services, etc. Fair trading, if you're not getting the expectation, not having the supports or the product that you're expecting, or it's faulty or not good, fair trading is there. And of course, the NDIS Safeguards Commission. I know there's a lot of discussion around the Safeguards Commission and how it's going, and there's a review, I think, either just finished or in place around how they perform, but that is there for our pathway of troubleshooting and getting some supports around the plan. So my last slide next is simply just some contact details for keeping in contact with us or reaching out to us for any information and advice. So that's what I wanted to share with you today. Thank you.
Great. Thank you so much, Karen. I think that really helps round out what we've been talking today, and you had some really valuable advice you've added there. Yeah, if anybody wants to get in touch with people, we'll share the slides afterwards, and you're always welcome to get in touch via myself to get people's contact details as well. Thanks again, Karen. I'll move on briefly to talk again about Reimagine today. as I mentioned earlier, it's the reason that we're here today, and it's a support resource that people can use through the process of navigating access to the NDIS, and it's specifically designed for people and by people living with mental health conditions, as well as other supports and carers and family. So you can find it at reimagine.today. One of the things that we were doing over the last couple of years was creating new resources around skill building, and that they were built by and in consultation with people with lived experiences of mental health distress and conditions, and family and carers as well, we consulted with. And here you'll see our national peer leader team, or that was at the time in October, November 2019. And they contributed a lot to the process of building those resources, both through their lived experience and based on the conversations that they had with people around Australia around the NDIS. As mentioned earlier, we focused on topics that people identified as important for the NDIS journey. So things like self-advocacy, decision-making, self-care, and topics that can be a bit tricky to decide about, things like options for plan management. So through that, we created a whole bunch of resources. They're all hidden inside Reimagine Today, but I'm very happy with any of our printable resources to print those out and send them to you, and I can do multiple copies. Anything NDIS related, I'm really happy to print and post. We've got things like a checklist on self-advocacy there, a decision-making tool, our new Reimagine workbook, which is also available in 8 other community languages now, you know, Arabic, Mandarin, well, simplified Chinese, and Farsi, Persian, Vietnamese, etc. Yeah, if you want to order any of those, you can email me directly. You'll probably get my email address at some point, and it's also reimagine@mhcc.org.au, which is up there. And there's some other resources as well to explore there. We've got videos and shared experiences from people. So again, everybody that contributed to this had their own sort of lived experience, and those videos are all of people sharing their advice based on their lived experience of applying for the NDIS and having an NDIS plan. There's also some e-learning activities, so exploring topics like what is self-advocacy and how you do it, the skills that you might build for the NDIS. Our workbook exists now as an app, so you can have that with you ongoing on your phone. You can have that information kept with you. And finally, there's the Self-Care Hub, which again was highlighted as one of the important skills for people to kind of keep with them along the NDIS journey. And we've gathered together some resources and advice for people there. So there's lots to explore, and I encourage you to do that, and please feel free to send through any feedback or questions or orders. And next up, I'd like to welcome back all of our speakers for a Q&A panel to address some of the questions that have been sent through, and hopefully we'll get through all of those. Yeah, so there were a lot of questions that came through. Welcome Annalise and Peanut and Karen, Nina. And yeah, we'll hopefully get through all of those questions. Yeah, so thanks again, guys, for all of those really fantastic presentations, and in advance to your answers here. So to start, first question is, can I get the NDIS for mental health such as PTSD?
Yeah, so in short, yes, this comes under psychosocial disability.
Great.
Karen, did you Karen, did you want to add something there or not?
I think the only thing I might have been going to add, but I just might have been another question, was just in terms of, and someone had it in the chat, the episodic nature of mental health, and the fact that you feel you can't do it if it's not a daily thing. And Annalise did speak to it, and you've obviously got that experience, but certainly you can with episodic requirements of your mental health, you absolutely can apply for the NDIS. Just continue to look at those life domains and see where the issues arise for you on different days, and that's absolutely a possibility. I don't know if Annalise wanted to add anything there.
Yeah, well, that's another question as well we've got coming up.
Sorry.
So that's, yes, definitely you can access the NDIS for mental health under the psychosocial disability stream. So next, what do you do when you're refused NDIS access because of not having enough proof of your illness?
I'm happy to take this one. First of all, I've kind of had this process when I was applying for the DSP. And for me, I needed to give myself some time to adjust and grieve to begin with, because it was a lot to process, like the disappointing news, and it really felt like a loss. And I needed to kind of get myself ready for the further work ahead, because I wanted to continue and reapply. I increased my self-care. I asked for support, and then I kind of gathered my support. So if I wasn't already connected to like a local disability or mental health organization, that's what I would do. And then I would gather and brainstorm what other kind of proof could I collect. And I brainstorm like what other types of treatment could I access for the disability that I experience, because then I can look into accessing that if that's possible, hopefully for free somewhere or discounted, or and then including as much supporting evidence as possible. So sometimes that might be hospital records, or for me, like my mental health condition has been an issue for over a really, really long period of time. And so it was the duration that meant that I was able to access and ask for lots of support documentation. So I guess just trying to find more proof, getting a carer's statement, getting your own independent statement of your experience of your disability. Yeah, there's lots of other things you can do.
Thanks very much for that. Nina, did you want to add anything there?
Oh, well, yeah, so if you're refused, what I mentioned earlier was then you have a right to appeal. So ask for an internal review. You can do this over the phone. You can just ring them up and say, I want an internal review, and they'll give you, it's 90 days from the day of the decision, and then just collect evidence on that advice that Annalise gave you, more supporting evidence and to back it up. And yeah, an OT, like I said, is invaluable if you have access and the resources through financial resources to do that. But everything Annalise suggested is great information and tips, because sometimes this just happens that you're living with a mental health issue, psychosocial disability, and you've got no evidence, and that's where it does become tricky. So yep.
Great, some great advice there from both of you. Thanks for that. And next is, how can I find the quickest way to apply for the NDIS and get a contact person? So it's another quick and easy one.
Yeah, so you can download the access request form straight from the website. The only thing I actually do suggest that it's probably better to just ring the number, the 1-800 number, and register over the phone. And then they will send you an NDIS access request. They'll give you a registration number there on the day. And it can take up to 20 minutes. And at this stage, you can have a support person with you as well, in case you miss some of the questions or you're just not clear on what the process is. And yeah, and then when you get the access request form, then you complete it by a health professional. And that's where, again, ask for support at this stage, so you understand the information on the access process.
Okay, great. So the next one's a bit trickier. How do you prove you have undertaken all available treatment options?
Actually, I think this one, I know I was pretty generic. You've undertaken the treatment and the outcome of the treatment. You've got to provide that evidence, but sometimes there isn't. There may be reasons why you couldn't get that treatment. So then you've got to explain that situation to them. But like I mentioned before, specialist letters from your GP, from your specialist GP letters. You can always ask for all of your medical information from your GP or previous GPs. You should have access to that. It's your information. A lot of people don't realise they can request that. And all reports from, even if it's 20 years ago, just include whatever you've got. Even if it's school reports, include that. Because sometimes people, even as early as school age, have had assessments done, and also within their school reports, it shows a continuation of a disability that people have lived with from an early age. Annalise?
I would really just reiterate everything you said, just being as thorough as possible, thinking of anything, anywhere that exists that will prove or give evidence of the day-to-day functional impact of your disability. Provide that.
Great. And Karen, was there anything you wanted to add there?
I guess the only thing I might add there is maybe a bit of a do your homework kind of situation, because what would the NDIS potentially, knowing that that grouping of disability is that person, what might they presume is treatment that would have been undertaken? And there's a lot of information on that on their website, and you'd have a good sense of what they're expecting, and then you'd be able to counter that up front, because sometimes that treatment isn't actually valid for that person for many and varied reasons. So maybe a little bit of homework up front might give you some heads up as to what they would be expecting, and then you might be able to then counter that.
Yeah. Great. So there's a lot of options there for people that you guys have given, and again, there's a lot of resources out there that can support people with the process of gathering that supporting evidence, and Reimagine Today is one of those. There's a couple of pages that talk about and have examples of providing the evidence of different things, such as what treatment options that you've already undertaken. So next question is, how do you avoid a person being disheartened by the way family, carers or workers are advocating for them? Annalie?
Yeah, I'm happy to speak to this. I guess the reality is that the process can be disheartening, but I guess as carers, family and workers can do the best that they can to make it less disheartening in a lot of ways, and that would be seeking to include the person with the disability at all times. So I guess trying to put some of the focus on the benefits that will come to the person with the disability if the application is successful, and bringing it back to the goals that the person with the disability has decided on about what they want in their life and how they want to get there. I would say if you're in a review meeting or you're in any kind of exchange with the NDIS, you don't bring up anything that you haven't discussed already with the person with the disability and they've agreed, or they've agreed and confirmed that that's something that they also want. So no blindsiding, no, I've just got the saying there, nothing about us without us, which is about you don't do anything in relation to advocating for the person with the disability without the person with the disability. And I think a way to avoid it is when you come out of the whatever it is that you're in, the meeting, talk to the person with the disability and say, how could that have gone better? Like, how was that for you? And if someone is distressed at that time, leaving it until a better time when there's less tension or it's less distressing. And yeah, well, really coming up with a bit of a plan of how you foresee the meeting or exchange going. So before you even go in, or before you write the email, or before you make the phone call, or before you have the meeting, talking to the person with the disability about what is it that you want out of this meeting, how do you see it happening, what do we want to say, what do you want to say, what role do you want me to have in this exchange?
Yeah. Wonderful, thanks. Nina, did you want to add something there?
No, I was just agreeing with Annalise. Yeah. She covered that really well.
Absolutely, absolutely. Annalise, you're getting all the hardest questions, I think, today. And I'm going to skip the next one so I can give you another curly one. I'm concerned that episodic disability might be considered less or not funded to the same level. What advice do you have?
Well, for me, like, my disability is episodic. there's never a day where I'm not affected by my disability, but it really varies in the severity. So when I applied, I would write the application as though it was relating to my worst day. I would think, what am I like on my best day? And this is how I'm affected by my disability. And what am I like on my worst day, the day that I'm most affected by my disability? And this is the day-to-day functional impact of that. And yeah, and also that it's been an enduring episodic disability. It hasn't just happened once, or it hasn't just happened twice. That it is like I can show and I can prove that this has been an ongoing issue, and it is likely to come back. So yeah, that's what I would do. I don't know if anybody has any other thing to add, but my experience is that I have been funded to like quite a significant level, but yeah, it might be different for everybody, and I guess it's about the functional day-to-day impact.
Okay, thank you so much for that. I think that's a really valuable advice for people to have there. So I'm aware we've actually just gone over time. So I thought instead of answering these last questions, and we'll hopefully get onto some of these last questions in our next webinar, which is on the 30th of March for those who are still online. Does anybody, Annalise, do you want to add any last thoughts, or Karen, Nina, do you want to add any last thoughts?
Oh, good. Thanks for asking me to be involved, and I'm really grateful that lots of people have come along to hear and learn about this.
Yeah, absolutely.
And I'd just like to add that your rights matter. With whatever life choices you make and whatever goals you have in life, they matter. They're important, and always remember that.
And I guess I'll have to say something too now. So I would just say, look, the NDIS has been a huge shift for us. It isn't perfect. It never will be perfect. It's a government system. So let's not kid ourselves, but let's make it work as hard as it possibly can for us. Okay, so the tenacity that Annalise showed is amazing, and I know not everyone can do that all the time, but you do it when you can, and you push through and get the life you deserve.
Wonderful.
Great.
Thank you all so much, especially to Nina for all of your work preparing all of that main content that we covered today. And Annalise and Karen, really enjoyed your presentations and what you added to the conversation today. We got a lot of wonderful comments online, so I hope that it hit the mark for a lot of other people. Thanks also to all of you for joining us, and yeah, I hope it's been a beneficial day. Again, if you have any questions or feedback, feel free to get in touch. You can either email me at Elizabeth, ELIS for Sam, at mhcc.org.au, or reimagine@mhcc.org.au. And finally, as this webinar contained content around potentially stressful topics, I'd recommend that each of you talk with someone just to debrief about it and discuss how you feel about it, or some of the thoughts that have come up for you about it. Please reach out and talk to someone you trust, or you can reach out to a support line like Beyond Blue for brief counselling referrals, and their number is 1300 224 636. And obviously, if it's an emergency, call 000. So take care and stay safe, and thanks again. Bye for now.
Thanks, Liz. Thank you.